The nation's drug epidemic just hit a stunning new record. According to the CDC, more than 100,000 people died of drug overdoses in the United States during a 12-month period ending in April of this year. That is the first time ever, and fentanyl is driving the staggering numbers. It is up to 50 times stronger than heroin and 100 times stronger than morphine. It is commonly mixed with other illegal drugs like cocaine and meth and made into pills that look like other prescription opioids. And joining me live is Stephanie Anderson. She's a clinical social worker and the CEO of Recovery Centers of America in Indianapolis, along with Brian Foster, one of Stephanie's staff members and an addiction peer recovery coach. And Steph, I'm going to start with you and just talk a little bit about, this is something that you live and see all the time. And I don't know that anybody's surprised by the number of deaths. We keep thinking, how can they continue to go up? When are they going to start going down? What do you just say about the sheer numbers that we're talking about?
Well, I think we're also continuing to be overwhelmed by the sheer numbers that are coming in and the need. I don't know that we know when it's going to come down. Between the pandemic and the social isolation that was the result of that, and the availability of fentanyl-laced drugs, there doesn't right now appear to be any end in sight. And Indiana was decreasing their numbers 2 years ago, and now they've gone up by 32% in the last year and 30% the year before that.
And again, before we get to you, Brian, why? I mean, we just want to know, like, what do you have an opinion, even though the stat might not be there? What do you think is the problem?
I think it's multifactored. Trauma is a huge component of substance use disorders. Most of the people that we see come in have some sort of co-occurring trauma or mental health disorder. And then it goes undiagnosed, and the relief for that is substance use. I think the other thing is shame and guilt. People don't talk about substance use disorders the way we talk about any other disease like cancer or diabetes. And as a result, people don't get treatment or care.
Yeah, and Brian, I want to bring you into the conversation because you're in long-term recovery from opiate abuse because you had a sports injury. Yes. Yeah, can you share a little bit about, there's so many people watching that have faced what you have.
Sure. Yes, when I was in high school, I had a bad back injury playing sports, and before I knew what happened, I was physically dependent on those pills. I'd been on them for about a year, and then from there it just progressed. You know, it went from buying them on the street to heroin, and then IV heroin use, and it was just cheaper, and I couldn't hold a job, being addicted. So before I knew what had happened, it was out of control, and I think that happens to a lot of people in this field.
I think though too, when someone can see you today in your position, that gives them hope. Man, the people watching this morning are saying, okay, I can have hope. I can maybe deal with this. We only have a minute left, and we talk so much about fentanyl. I want to get to a little bit of this. Like, where is so much of it coming from? We hear things about China. We hear about cartels. What is the true story about where all this fentanyl is coming from?
So I think it's coming from everywhere, I think is the answer, and that's why you hear all these different stories. Ultimately, what we know is that it's being made in labs in foreign countries and finding its way through the border at Mexico. Indiana is particularly tough. We're the crossroads of America. So every major pathway comes through Indiana and stops through Indianapolis where drugs can be dropped off. And it's cheap, and it really gets people hooked fast.
We have about, again, just a little bit of time. I want the final word from both of you. Like, what do you want people watching this morning? What do you want them to get out of seeing this discussion?
I want them to know that there's hope. You can see someone like me who was hopeless, and I was able to seek treatment and live a life better than I could have ever imagined in recovery, and I want people to know that's possible.
Yeah, and it's you.
For sure. Treatment is out there. Don't wait. The more you think you've got time, the less time you have. But people like Brian really do show that hope is there, and we can help.
So thankful for you. Thank you for sharing and being that courageous and brave. If you'd like more information on the Recovery Centers of America, fox59.com/links, and we'll be right back.